I added just the mental note. Since it's the beginning of the 11-day period until phase 1 officially starts, please do not have any gatherings above 5, just to keep it safe. So, anyways, so Ontario, they're reporting 870 coronavirus cases. Okay. So 225 cases are from Toronto, 167 from the Peel Region, 55 is from Niagara Region, 49 is from 49 is from Porcupine County, which I am not familiar with. But they made it on the list today. 45 from Hamilton, 44 from Durham Region, and 43 is from Ottawa. So. And York Region got 28 apparently, but they didn't make the list today. So all other regions are reported under 40. 10 deaths have been reported today. Okay, variants. So just I will refer to I'll mention both the original name, the actual name, and the nicknames given to by the WHO. So okay. So coronavirus cases. So variants. So. So let's look. So the UK variant, aka Alpha, is at 128,559 cases. Our biggest threat. An increase of a plus 914. South African variants, aka Beta, is at 954 plus 2. Brazilian variants, aka Gamma, is at 2,921. Are technically our second largest threat right now. The plus 10. And reports from Peel Region. The India double-mutant variant, aka Delta, as they are calling it, is at 97 right now from the Peel Region, and could enter into the current surge right now that could affect the rest of the province. And compared to the Peel Region, and the rest of Ontario, as mentioned by Medical Officer of Health in the Peel Region, Dr. Lawrence Lowe, and also Dr. Peter Juni, who's in charge of like that, So the Peel Region is like compared to other regions, it's like they're like 3 weeks ahead. So they're in the danger zone. Yeah, there's so in no, that's trouble. So Dr. Lawrence Lowe requested, treat if we can take care of and Dr. Peter Juni, they both said that if we take care of Peel Region first, and then it will be sort of easy. This surge won't happen and won't affect the other parts of Ontario, so which is good news. And apparently, since the Delta variant is more transmissible, and yeah, it could apparently it's gonna like take over the cases compared to the UK variant that's going to like outnumber it. Okay, so you want to sign up for vaccinations. That is for 12 and up. Through the website covid19.ontario.ca/book vaccine, by phone 1-888-999-6488, pharmacy through local health units, and also for youth 12 to 17, they can do at farms, special dedicated youth and family clinics, and on special and only on Tuesday. Pop-up clinics, mobile clinics, and walk-in appointments on Tuesday, and youth not 12 can book at 1-833-943-3900 or through public health units. So the 11 that they ruled are in effect. So the rules are down below. Starting today until June 13th, which will be the last day before Monday, June 14th, where phase 1 officially begins. So outdoor social gatherings, 5 people maximum, can be larger only if the people at that gathering are from the same household. So those who live alone can can gather with one household. Essential shopping, capacity is 25%. Restaurants only is still at takeout, drive-through, delivery, personal. So personal care is all available starting phase 2, probably sometime July. My estimate, judging by the weeks. Gyms and fitness is only for professional athletes. The indoor recreational facilities only for childcare, mental health, and addiction support service, social service, and physical therapy. Outdoor fitness classes is available phase 1 starting June 14th. So outdoor recreational, place, they are allowed for use as long as you are wearing a mask at all times and physical distancing at all times. So weddings, funerals, and religious services, that's still 10 people, maximum 10 people, mask on at all times. Outdoors, and physical distancing outdoors. So apparently travelers who refuse a hotel quarantine will soon face larger fines apparently. So international flights, so they either go through the airport in Vancouver, Calgary, Toronto, the Lester Pearson airports, or Quebec's the Dorval Airport. So apparently, federal government's going to fine people who choose to skip it. So a maximum of $5,000 a day per day. Well, as of Friday. So that's 67% higher than a $3,000 fine that's currently in place. So. So some travelers have been choosing to pay that $3,000, then submit to the quarantine process, which first you have to get once you're allowed to go on your flight, you get COVID. Coronavirus tested at the Vancouver Airport, Calgary Airport, Pearson Airport, or Dorval Airport. And then also staying at a hotel for up to 3 days possibly, and to awaiting the results, and then which will cost you $2,000. So the Public Health Agency of Canada said 798 fines were issued between February 22nd and May 7th for refusal for quarantining in a hotel. So 606 in Ontario and 192 people in British Columbia. So apparently Quebec and Alberta, they're apparently the two provinces where international are still permitted land, apparently, so. So there's been some stuff about the hotel quarantine, hotel requirement to seize. Because due to the number of people who would rather just pay the fine than skip the hotel. Although the only concern right now is if people or international or domestic travelers from other provinces or from other countries, are they bringing coronavirus cases with them or variant cases with them? So that is the biggest concern. So Doug Ford was actually mentioning that how because there's been domestic flights and international flights, and they're bringing in coronavirus cases and variant cases and with them into Ontario. So that is the issue. So Health Minister Patty she said she would consult with the provincial counterparts before making a decision about relaxing any restrictions. So the government has said that more than 99% of the 99 point something, I forget the number, but more than 99% of travelers have complied with the coronavirus regulations, getting checked at the airport, and then also quarantining for up to 3 days at the airport, and then of course the 2-week quarantine at wherever they're staying at. So it's just a major concern. Are they bringing coronavirus cases or variants with them into our provinces? So remember, enforcement officers still have the regulations to break up any gatherings of any kind. More than 5. So if there's any gatherings more than 5, yeah, they can they have the right to have people disperse or narrow it down. So the fines $750 for EMCPA rule. Not so sure if it's in effect right now or not, but well, don't say. I haven't heard anything, but $880 sometimes with the additional 130 from 750 plus that the surcharge, or through ride checks. $1,000 for those preventing others from following orders. $10,000 for those who organize or plan the gathering. $1 million if severe, and possibly jail time. $729 people are hospitalized with the coronavirus, plus 21. Not good. 546 ICU patients, minus 30. Good. 370 ICU patients using a ventilator, minus 29. Good. So lower than usable. So long-term care home deaths is at 3,774 now. So that's another change. Staff deaths has not changed from since May 15th, I believe. And outbreaks has lowered down to 25, minus 3, though, from yesterday's number. So, follow coronavirus safety rules and regulations, and the 11-day rule before the 3-phase rules officially start. And please do not have any gathering above 5 for the safety of others. And there is also a risk of a wave 4, which could be caused by the Delta variant. So yeah, that's that. Let's hope that the Delta variant is dealt with before it causes trouble and wave 4 starts, like Dr. Lawrence Lowe and Dr. Peter Juni mentioned. Oh yeah, and sign up for vaccines if you haven't.